Welcome back. Thanks for staying with us. You're watching SA Today with me, Flo Ledwaba. Well, the impact of COVID-19 pandemic on hospitals has stretched blood supplies in the country. Recently, the South African National Blood Service, SANBS, has experienced poor collection due to, among other challenges, low donor turnout to mobile blood drives and donor centres. With less than 3 days blood stock currently on hand, the SANBS is calling on donors to rally behind this life-saving mission to help save thousands of lives. For more on this, we're joined by the spokesperson of the SANBS, that's Dr. Karin van den Berg. Dr. Karin, thank you so very much for being with us. We appreciate your time here on SABC News.
Thank you very much for having us. We really appreciate the opportunity to share our crisis with the viewers.
You're most welcome. I mean, is this shortage, I mean, just as I saw that there is this big shortage, I mean, is the shortage linked in any way to the issue of COVID-19 and the vaccinations? I mean, given that there's this hesitancy to vaccinate, might people also be feeling some sort of hesitancy towards the process of giving blood and needles and so forth? I mean, what do you think this is all driven by, or what do you know it to be driven by?
So what we definitely know is that our traditional methods of collecting blood has been irrevocably changed by the COVID epidemic. So where we would usually in the past be able to go to schools and to big business and collect 50, 60, 80, 100 units of blood in an afternoon or in a morning. When we go there now, either people don't allow us to come onto their premises, or if they do, there are so few workers at work that, you know, the work from home policies that many companies have adopted, that where we would normally get 50 or 60 units of blood, we are now lucky if we get 10. So that has been a really big impact on our ability to collect blood. And then secondly, what we see is that after each COVID wave, as the hospital beds become more accessible to people for their routine treatment, there's definitely a surge, there's a run on blood. So during the COVID waves, the hospital beds are occupied by COVID patients, and the other patients, such as our cancer patients, oncology patients, even the elective surgery cases have to be postponed. And then when the beds open up, there's a run. We're still not able to collect enough blood using traditional methods. And then we have this. And this is all aggravated, I think, by some of the vaccine hesitancy that we see.
Let's paint the picture then. I mean, you've given me a slight indication there in terms of how bad the situation then becomes when it comes to the healthcare sector. Take us through that situation right now, the fact that we're so low on blood stock. What more is happening as a result of that?
So what does happen is that as of this morning, we have had to implement what we refer to as cutbacks, meaning that when a patient maybe needs 3 units of blood, we will only be able to issue 2, or in some cases where patients need to have 2 units of blood, we will only be able to issue 1. For us, this is it's a horrific thing to do. We pride ourselves on being trusted to save lives, on meeting the healthcare needs and demands of the country. And so it causes a tremendous amount of stress within our organization, because this is not what we want to do. But what it also means is that we run into situations where, we collect the blood today, it's day 1, tomorrow we test, it's day 2, and the 3rd day is when we distribute. And so if we only have 2.5 days blood, it means that we actually are living hand to mouth. So we do run into situations now where some of our more distant blood banks will actually run out of blood. And we need to send blood to them twice a day. As the blood becomes available, we have to process and send it as quickly as possible. It means that for a couple of hours, it might be that there's no blood in the blood bank. And that is just, it is a tragedy, really.
Well, Dr. Karin, I'm sure this is the right platform then for you to talk to people, maybe And perhaps more importantly, to explain for those who have never donated blood before, what the process is, what do they do, where do they go, maybe just to take away whatever hesitancy or fears that people might have when it comes to donating blood. I think now we do understand the fact that we're so low in blood that it's actually, you're not able to save the lives that you're able to do, and it should certainly weigh heavily on anyone with a conscience at this time. So maybe if you can explain, I know there's a lot of people who come regularly to donate blood, but there may be people who have never and have thought of doing it. Maybe if you can explain that process and where they arrive, what they do, what happens.
So firstly, I think perhaps I must just mention that at SANBS, while we 100% support the government's appeal to people to get vaccinated, whether you are vaccinated or not, you can come and donate. We accept blood from anybody that meets our requirements, which is that you lead a healthy lifestyle, that you are between the ages of 16 and 75, and that you weigh at least 50 kilograms. So those are the bare minimum criteria. And thereafter, so the easiest thing is to go to our website, sanbs.org.za, and there you can see, you'll be able to find what the closest blood drive is to you. In most instances at this stage, it is in the local malls. You'll be able to find a SANBS mobile center. When you get there, there's a simple questionnaire to complete. Ask a couple of questions. There's an assessment, a mini health check, and then you can donate. And so it's a fairly simple process. It takes between 20 and 30 minutes, depending on how busy the clinic is and how quickly you are able to fill the bag. But it is a little bit sore when the needle goes in, but it's not that bad. We do it 1 million times a year. And so, yes, we are really urging people to consider to come and donate blood.
All right. Well, Doctor, I'll try again. I've gone a few times, and I'm always told I'm low on iron, and I don't know what to do apart from eating iron supplements or whatever.
It's very simple. Bring a friend.
So I'll do that. Yes, all right. So I'll do that. I'll try and do that. But thanks very much, and I hope that we certainly can get some help and get some people in there to come and donate blood. We appreciate you giving us your time.
Great, thank you so much.
You're most welcome. All right, that's Dr. Karin van Berg, who's SANBS medical director and spokesperson, talking to us about the shortage then, and of course the fact that hospitals are stretched at this time with blood shortages. Please take a look at that number that's on the screen at the moment. You can certainly call to donate and get an appointment. It's 0800 119 031. So that is the number. Please do donate blood.